what our current medical system does very well, where chiropractic can fit into that conversation. And most importantly, we're going to give you some practical steps you can start using immediately to improve your health trajectory. Uh, First and foremost, see if I want to move here. Come on. There we go. Heart disease remains the leading cause of death in the United States. About 1 in every 5 deaths is related to heart disease. Someone dies from it roughly every 33 seconds. But what's important to understand is that heart disease almost never happens suddenly. It develops slowly over years and over oftentimes decades through a combination of lifestyle, environment, stress, and physiology. Um, that means that we have way more influence than most people think over that outcome in reality. If we take a snapshot of where we are currently in Alabama, um, heart disease is the leading cause of death in the state of Alabama. Recent CDC data shows that roughly 14,500 deaths happen from heart disease in Alabama every single year, with a mortality rate around 227 deaths per 100,000 people. There are some estimates that show nearly 24% of all deaths in the state are related to heart disease. And compared to the most recent, and compared to the rest of the nation, Alabama consistently ranks among states with higher cardiovascular mortality. That's not meant to discourage us. It's just simply highlights how important this conversation is in our community. Now, how heart disease impacts our life? Well, there are a few things going on here. Heart disease just isn't about heart attacks. Long before major cardiovascular events occur, people often experience really subtle declines in their energy level, in endurance, in our sleep quality, and our overall vitality. People don't feel like themselves. They feel tired more often. They often move less as a result of that. And usually that lack of movement and more fatigue is usually a sign that they're going to recover slower. Their quality of life begins to shrink long before their lifespan does. Now, most heart disease develops because of a combination of stressors. High blood pressure is definitely one of them. Metabolic dysfunction, inflammation, inactivity, poor sleep, and chronic stress all contribute to gradual changes in the cardiovascular system. The key point in that is this: these factors usually begin long before the diagnosis, which means they can be influenced long before an intervention becomes necessary. So let's kind of talk about some of these interventions. All right. So the traditional medical approach is kind of this right here. Um, First, we need to understand that modern medicine is quite extraordinary. It saves lives every single day through early detection, through medications that manage risk, through emergency care, and through life saving. In fact, there is no substitute for modern medical care. It's important to say that clearly. Chiropractic does not replace medical care. Our goal is to complement it. Where healthcare, uh, where a healthcare system can struggle, is that healthcare can struggle is in what we're going to call the upstream space. All right. So if you imagine, picture in your mind those old cartoons we used to watch or old movies, and you see the hero, Mickey Mouse, in a boat going down a river heading towards a waterfall, right? Ideally, the time to help intervene to help Mickey Mouse or whatever our hero is while they're upstream, away from the waterfall. That's what we're going to call the upstream space. So healthcare can struggle in that upstream space. Most care seems to happen after risk has been developed or established that there's a problem. Providers are often limited as far as their time is concerned to focus on behaviors, to help change the lifestyle habits, and to help improve their functional stress. And yet, these are the really important things that help determine their long term outcomes. So, how does chiropractic complement? How do we work upstream from where the crisis happens? Well, chiropractic approaches health from a different start point. We ask how the body is functioning and adapting to stresses. Now, those stresses for us are physical stresses, kind of what our body runs into day in and day out. They're psychological and emotional stresses, what we often attribute with stress. And those are chemical stresses, right? The substances that can kind of build up in our medications and our food and our water and our air. We ask how the body is functioning and adapting to the stress. We ask how well someone can move, recover, and handle the demands of their specific daily life. And because we do this because when function improves, behavior improves. And that changes their health outcomes over time. So I guess we can ask, what is chiropractic? Chiropractic, I guess if you don't know, is a healthcare discipline focused on improving movement, reducing physical stress, and supporting the body's ability to function at a higher level. We don't directly treat heart disease, and it's important I say that, but we do help people build healthier lives that support their better physiological outcomes. Our chief goal chiropractically is to restore function so people can live a more active life and adapt better to the stresses that are in it. When people move better, they tend to sleep better. When people sleep better, they recover better. And when they recover better, they have more energy. And those changes, just like investing in real estate, or investing in stock market, investing in your stocks, compounds over time. It gets better the more we do it. The more we invest in our health, the better it gets. Chiropractic supports health, or chiropractic supports heart health indirectly by helping people stay active. It supports it by helping people improve their sleep quality and reducing physical stress and improving their overall well being. And when these habits improve, cardiovascular risk often improves alongside them. Thus, we're helping things upstream from where the waterfall is. Now, no adjustment replaces healthy habits, but chiropractic care can help people actually follow through on them. Heart health is built through daily choices, not occasional effort. So, how does chiropractic care help with that? Well, if you did nothing else, how can chiropractic help with that? If you feel better and you move better, you're going to want to eat better to support it. You're going to want to sleep more. Your stress is going to be reduced just by that extra movement. So, helping things upstream is definitely the way to go. So, what are some practical things we can do? How can we help implement things right away without ever having to step into a chiropractor's office? Well, we can start with a couple things. Number one, if you did nothing else but walk after meals, sleep consistently, eat more real foods, and move more often, you would dramatically change your long-term health trajectory. Small, consistent actions matter more than perfect plans. So, starting this week, take some time, a few minutes, doesn't have to be long, 10, 15 minutes, to walk after you eat. Make sure you set an alarm to go to sleep on time. Your body recovers best when you go to bed early. Eat more whole foods. Eating more whole foods cuts down your risk of eating too many junk foods or hyper palatable foods. Reduce the amount of time we sit sitting. Our bodies are meant to move. I know the current modern workplace requires us to sit, But setting time every half hour to an hour to get up and move makes a huge difference. And then work to intentionally manage your stress. Don't wait till it builds up. Be proactive. Now, what does that mean? Well, first and foremost, that's usually going to mean setting aside time every single day for prayer, meditation, for exercise, conversations with friends or family, doing things that have been proven to help your psychological, spiritual, and emotional well being. Those are going to be the things that are going to help you intentionally manage stress. And the more of that we can build into our day, the more we buttress ourselves or make ourselves more resilient to those stresses. Now, a lot of this is abstract, right? It's in the ether. But I want to show you a real world example of how consistency plus proving function can build confidence and help you achieve a healthier, higher quality life. So I'm going to share a brief story of a patient of mine whose name I will redact, but I'm going to call her Miss Sue just for convenience. So Miss Sue is a patient who came in morbidly obese with a lot of back pain, as a lot of heavier people can have. What really stood out wasn't just the pain that she was having, but it was also how consistently tired she was, even after a full night's sleep. She wasn't sleeping well. She wasn't moving well. And she had expressed to me she felt like her energy had disappeared over the years. This had taken time away from her family. It had taken time away from her husband. It had taken time away from her job. And it had taken time away from her hobbies. Right? How many of us do we know who live in that world as well? Now, as we worked to address some of her spinal mobility problems and her other joint mobility problems, we saw that she was able to move more without less pain. Her body's physical stress, the tight muscles that she had, went away as well. That inspired her to start moving more and more regularly. As a result, her sleep improved, her energy improved, and guess what? She ended up losing a whole boatload of weight. In a couple months we worked together, um, again, this didn't happen dramatically overnight. I couldn't snap my fingers and just make this happen. But with steady progress, she ended up moving more and more, and she lost about 60 pounds in just, probably about 8 months. Now, there are some tangible benefits that go on with that kind of weight loss in and of itself. Again, losing 80 pounds, that's a major improver in heart risk. It's a major improver in all-cause mortality. In fact, she was able to get a job as a result of how much better she was feeling. She was able to be more connected with her family. She was able to be more intentional and connected with her kids and be more present at the functions like baseball practice, at softball. She was able to be more part of that. She told me towards the end of our care together that she just felt like herself again. It's amazing. Again, we've all heard this analogy of boiling a frog. Um, we know for a fact that when we kind of go through these changes that happen with our life, happen slowly over a long period of time, kind of like the analogy of boiling a frog. We've probably all heard it, that it's impossible to boil a frog by taking it and tossing it in a pot of boiling water. But if we put the frog in a pot of cold water or room temperature water and slowly increase the temperature with time, that by the time the frog is aware that there's a problem, it's already too late. It's already boiling. For most of us, that's how this stuff builds up over years and decades. It's not that we eat out once or twice, or that we don't exercise once or twice, or that we are stressed out once or twice, or we stay up late once or twice. It's that once or twice turns into a pattern, which builds over time, which becomes a habit, and those habits have tangible effects. So what's the big idea? Right? Well, the big idea is this. Health is built upstream. Medical care is used for rescues, right? We shouldn't be relying on that to prevent the problems. That's when we've let things get out of hands. Our focus should be on the upstream part of health. How do we change our lifestyle? How do we supplement that with chiropractic to make us more resilient to these health challenges, to these heart risks. If we can do that, we can see some really major tangible things. So, how do we move forward with this, right? I think the most important thing is that when you get knowledge, is that you are motivated to do something with it. And for me, again, this is February, it's the month of love, right? Hearts are everywhere. So, how do we try to help someone, right? Well, our next steps would be a couple. First things first, right? If something today sparks something for you, right? This could be for you, it could be for a friend or a family member or even a coworker. Well, the next step is pretty simple. We're offering in our office a limited time new patient opportunity. 14 new patient evaluations for $14, right, for Valentine's Day over the next 14 days. It's simply an opportunity to understand how your body is functioning, help identify stressors, and create a plan for moving forward. Right? There's no stress, no gimmick there. There's no pressure. We just want to give you information and help provide clarity. If that is appealing, please reach out to our office, right? Jubilee Family Chiropractic. You can either reach out to us through Facebook, through our office website, or just give us a call. Our number is 256-486-3911. We'd be happy to help set those up. Again, space is going to be limited on that. I'll leave you with this. Your health trajectory is not fixed. It's shaped by small decisions repeated over time. You don't have to be perfect. You just have to begin. My grandmother always used to say the best time to plant a tree was 30 years ago. But the second best time is right now. So I want to say thank you for being here with me today and for taking the time and investing in your health. I look forward to hearing from you soon. I look forward to serving you and your families as we move forward so that we can all share a healthier, happier tomorrow. Take care and God bless.